Hey guys, we're going to talk about something that it has been on the tip of everyone's tongue. I mean, we talk about it at our kitchen table, we talk about it at work, at the office, we talk about it when we get together with friends and family. Healthcare. You might have an idea here, an idea there. You might be on this side of the aisle, that side of the aisle. We're on different sides of the aisle on the issue, but we know we got to fix it. We haven't fixed it yet. We're going to talk about that and some things that are on everyone else's imaginations as well, because there's a lot of things and a lot of discussion coming up. We're going to put our slant on it today on River Talk. Well, hello there. Welcome to River Talk. Good to have you with us. I'm, of course, Jack Murphy. We're at the Coastal Ale House. We're going to be moving around in 2017, doing a lot of different things. And I do a lot of different things all the time. I know you juggle a lot of different things.
I do. But this thing is very close to my heart. I'm concerned about poor people in healthcare.
Sure.
I'm concerned about people with pre-existing conditions. And I brought an expert that knows what she's talking about and can help guide us through the weeds.
I'm in the weeds a lot, Darralyn Alexander.
Well, and let's take a high-level view of, first of all, why do we have, and this is really Obamacare, as people call it, but it's really accountable care organizations or accountable care health. Let's take a look at what was the original purpose of this whole accountable care. And for people to realize that Obamacare is accountable care, when they say they want to keep accountable care, they don't realize that slash is Obamacare too.
Right.
So the main purpose of accountable care was that President Obama, as well, and further back, even in terms of the Clintons, they recognized that there were a whole group of people that were not being cared for by the healthcare system, and that they didn't have any health insurance at all, and that there was more that we needed to do in a coordinated fashion in order to achieve this. So one of the things that under Obamacare of accountable care is they decided to have hospitals and physicians work together to provide these people care. And that there was coordination, because what we were finding is that we were paying more and more money, and these people went out just as sick as when they came into the hospital, or just as when they came into the doctor. All we keep on doing is throwing money for labs, for surgery, for this, for that, and not fixing the system.
Sure.
And so this was about fixing the system. The other thing that was going on is that a lot of people are born with pre-existing conditions.
Like diabetes?
Like diabetes.
Yeah,
so there's young children that develop cancer, there's people that develop renal failure that are children and young adults that through no fault of their own, they now can't get insurance under their parents' plan, so they can't get insurance themselves. Because as we grow and we move around, we change jobs. So the insurance companies were not allowing, due to pre-existing conditions, for these people to have any insurance at all. They would rule that out and say, oh, we'll give you insurance on these things, but where you most need it in terms of cancer, in terms of diabetes, in terms of end-stage renal disease, in terms of congestive heart failure or heart disease at all, we're not going to provide coverage for that. We're going to rule it out. So Obamacare was put in place for pre-existing conditions so that they could get the care that they need so they could remain healthier.
In the absence of Obamacare or affordable health care, what does that mean to the average citizen that's on Social Security that may or may not have health insurance?
Well, for the average citizen that doesn't have health insurance, that means that they make do. They go to the emergency room, which is very...
Who pays for that?
We pay for that.
Sure.
You know, a lot of people think that, well, I don't have insurance, I'll just go to the emergency room. But that's called uncompensated care. So the hospitals under Obamacare now get all of that money reimbursed, but they can lose up to multiple millions, $170 million, and they have gained that amount by having Obamacare.
So the Conway Medical Center and Grand Strand Hospital all could be losers in the game as we look at healthcare services.
Sure, and they have been the losers. Before Obamacare, they had uncompensated care, so hospitals had to take the bite for every time a patient came in that didn't have sufficient insurance or didn't have any insurance at all. The hospital ate that cost, and how does hospitals redistribute it?
Well,
it redistributes to all of us.
To everyone else. Well, on both sides of the aisle, the politicians do this because insurance is regulated. It's regulated, and it's regulated by governments, which ultimately those...
I think whether you're Democrat or Republican, what we've got to do as a community is come together and recognize that health insurance is a critical issue for all. And then once we recognize that and begin to assess where we are and where we need to go, I think we're going to be all right. I cannot believe that anyone in their right mind would want to wipe out health care for those that are most in need, for those that are forced into poverty through no fault of their own, for those that have pre-existing conditions through no fault of their own. We've got to be able to work these things through. And I'm hoping that this young lady can work with us and others. And for people that's interested in getting involved in this, they can give us a call.
Well, how do people get involved? Because we're going to have you for the whole show. But
We got
you for the whole show. Let's talk about this.
Let's talk a little bit more about what healthcare does for individuals. So it's not only the pre-exist, it's keeping your children on your health plan until 26. If you have a major illness like cancer, let's say, you used to have lifetime and annual maxes. What this does is now it removes that. So if you're sick, really sick this year and healthy next year, no. But if you remain sick throughout your life, now insurance companies can't say is that you've reached your dollar limit. And now that there's not going to be the gender discrimination. So women, unbeknownst to them, were being charged more because they were a woman. So there were many pieces that were involved in this. We are now covering 160,000 more people every year through having it. How we can expand it more and how we can have you all get involved is to talk to your state representatives and say that we want to expand Medicaid even more than it's expanded now. We certainly don't want you to repeal it because we'll lose our insurance, the state will lose it, everybody will lose if indeed you take health insurance away. So we need you to talk to your legislators and talk to them about...
Are most folks saying that Medicaid's off the table? I mean, I'm hearing from folks that align with me politically, they're saying that Medicaid's not going to be touched.
Well, I heard that rumor, but unfortunately, there's always a rumor. There's not been a solid statement or policy that lays it out. I think we need a policy statement that makes sense, that's practical, that recognizes that we can ill afford to repeal affordable health care.
Well, but even more than that, South Carolina didn't make the decision to expand Medicaid in their state. So how it is right now is that there's federal sponsored, there's state federal, and there's state. So South Carolina does not have Medicaid in place under the state. What we do is we borrow from the federal money. So we're still paying federal. When we say we don't want the federal to be involved, we are. Because every person that's getting accountable care, getting Obamacare, is indeed being paid for under the federal guidelines.
We got to take a breather. We got you for the whole show.
All right. Okay.
I got to pay some bills so I can pay my health care bill this month.
There you go.
It's a doozy. But we'll come right back with more because it's a discussion. We want it fixed. Everybody wants it fixed. We can agree on that. Good stuff today. More after this. Hey, we're back. We're talking health care. Sometimes we tackle heavy-duty subjects. It's something that everybody is talking about these days. Some aren't talking enough. We got to have, if we're going to get rid of something,
that's right,
or necessarily repeal it, it makes sense.
What are you going to replace it?
Yeah, you got to replace it with something, and those questions are out there. And I'm a little disappointed that that can't be answered. It should be able to be answered. I think it's going to be answered. The pre-existing deal makes sense for everybody. Right. I mean, for pre-existing
and for your children to stay on the policy,
if you so choose.
Yeah. And lifetime maxes, annual and for the lifetime makes sense too. Not having them, waiving them, because there are people that have devastating illnesses that they're going to have for a lifetime, such as cancer, such as diabetes, such as heart disease. And if indeed, for whatever your particular condition is due to genetics or due to how you've lived or beyond your control, you can go in and get the care you need without evaluating, oh, I can't afford to do this. I'm just going to lay in this bed and be sicker. And then you're still going to arrive at the emergency room, and you're still going to arrive at the hospital, but you're going to arrive sicker. So one of the things that having the accountable care does is it expands preventative care so that you indeed go on an ongoing basis for your diabetes, for your hypertension, for this. It does other things. If you're obese and you're of that age of bearing children, it allows you to go in and get your GYN visits. It allows you to be screened for a host of diseases that you didn't get screened for prior to that. So there's many, many pieces in terms of how having accountable care does for you. And mental health. A lot of people weren't covered under mental health. A lot of people weren't covered under drug programs.
Mental health, I mean, let me just back up on that. For young people, old people, people that suffer from mental health illnesses, we want to make sure they get the treatment that they deserve. We want to make sure that we don't end up with people in the streets wandering around without medication, having access to weapons, and taking other lives. We want to make sure that those that are affected by opiates, that we don't continue not to be able to provide treatment and care and services for those persons so that we can resolve.
And that can kick in, you know, because when you start, if you really, when you say mental health,
That's right.
it gets, because I was thinking of a situation where someone fell in their home and they were almost comatose for 2 days before they were discovered. So now they've got a whole issue of mental issues that come into play that weren't there. And it could happen to me, it could happen to
anybody.
It could happen to anybody.
And that's what it does. And then if you sit right outside of the $16,000 that you could earn as a single person, or $32,000 you could earn as a four-person family, if you fall right outside of that, you don't have access to those benefits. You end up showing up in the emergency room. So we need to be able to take a look at expanding Medicaid in the state to cover more people, because I earn $18,000 and not to $16,000. I can't get any of these kinds of services, and I can be as more cost to the system than the people that are currently getting it. So we need to take a look at what we can do as a society, as a South Carolina society, to extend benefits to those who need it, because these people are doing the medications, they still have to pay all their household bills, all these things, and at the end of the day, they don't have the money. They're still poor at $18,000 as they are at $16,000.
And we realize that South Carolina has the lowest weekly wage of any, Horry County has the lowest weekly wage of any county in the United States. Any county. So our people are not afforded a great deal of financial resources. We've got to compensate for that and ensure at least affordable health care.
I don't know the numbers, but how we touch on the numbers of people that, even despite there's a penalty, which comes into like the whole phase of the fine, and we talk about that. I don't like that.
Okay.
I don't like that just on so many levels. But they still, even after it's there and they've got that and they do qualify, they still opt. I mean, how do you? There's some folks who've chosen, I don't know the number, that have just said, okay, just whenever the taxes are filed at the end of the year, take my penalty off. What do you do? Because there's going to be a number of folks that regardless aren't going to take advantage of it.
And to some degree, we can't do anything about some of those that make the decision financially that they'll take the penalty because they don't want to put their money here. One of the things I found really disconcerting was for people who are employed, some of them were making the decision not to do it. So we've increased through employer mandates by $500,000 the number of people, by 500,000 people, the number of people that now get benefits and are mandated to. And they could afford it because they were employed in a capacity that allowed them to do it. The problem, of course, is when you're borderline, or you're a student and you're working part-time, or you're a mother who's doing 2 or 3 jobs and you make a little bit over that limit. How do we do that? And you don't have enough money to feed yourself. What can we do about those people that say, well, I'm not going to do it because I need that $500 extra. I need that $260 extra a month. There's some things that we can't convince people of, but if we talk to them in terms of their health and what the benefits are, and just take a breather and expand it more. To put it in real terms, if we expanded Medicaid more, we could have 160,000 more people in 1 year that have access to and utilization of health insurance across the spectrum for whatever their diseases are, be it small or large. And if it's indeed mental health and drug abuse, we could cover 87,000 more people if we expanded and give them a cushion. Because this is, again, about people working together, meaning the doctors and the hospitals and more insurance working together for your health outcomes.
And the thing that troubles
for your
me,
prevention.
The thing that troubles me is you've got people working 2 and 3 part-time jobs, making just about $16,000, maybe slightly above, and they may be denied the opportunity for health care. They're up 5 o'clock in the morning, they don't get a chance to take care of their own children, they're off in these hotels cleaning up, they don't have health care, they're in a bind. Let us remember that the world has to be about more than us.
Well, I'm one of those guys that works too. I'm involved in a lot of things. I have my own company, and I work too.
That's right.
I work a lot. I think one of the determining factors why there was a change and why there's so much We want the pre-existing condition.
We want that.
We want that.
want to
But
be able
my
to keep our
premium
kids.
went from $250 a month for me and my son, and it is, I just paid this year $678. That's how much it's increased. And that's $400 a month that leaves my community. That's $4 grand a year,
That's right.
and it doesn't do me any good.
And the reality is, if it wasn't for affordable health care, that $600 would be more like $1,500 to $1,800.
Well, they say that the increases, but I remember that my premium those previous years, I didn't see that kind of jump. That's 151% increase.
One of the things that insurance
So I'm not
companies,
buying that argument,
Yeah.
Benny.
but
Let
one
me
of-
push it a little further.
Okay.
yeah, one of the things that was said is
Well,
that
they're giving me the sign, and I don't want to get into
what
a
is the
point.
sign?
Well, I don't. It was a finger, but it was
Oh,
but it was a good finger.
Yes.
It was like,
Yes.
yeah, I was
Yes.
just getting that sign.
All right.
That finger.
Okay.
Number one, Benny.
Okay, number
one. We'll be right back with more in a moment. Hey, we're back. We're talking healthcare. It's something that everybody is talking about. And if you're not, you probably ought to, or at least listen a little
That's
more.
right.
And I've listened a lot more. And I will say this, for being someone that wasn't in favor of the Affordable Care Act, some good things have happened because it put the magnifying glass on a system for those of us that there was some things broken. And I think it was a good thing for a lot of folks, because when it hits somebody's pocketbook,
Then you can
we're seeing the cost. Yeah, and
right.
so there's some good things that came from that, because it did magnify problems that even I didn't know existed. So it was a good thing. It's a good thing. I mean, we can't say that.
And we believe that there are a number of people out there that have concerns and questions regarding affordable health. And what we're encouraging them to do is get on board. Let's work together. Let's talk about it. Let's plan together. We've got a phone number that's available to all of those folks that can call us at our Horry County Democratic headquarters. And we can look at these issues. We can call on legislators. We can bombard them with calls and requests that forces them to take another look
Sure.
at this issue that affects so many people.
Yeah, when that phone rings and
There'll be someone to answer.
someone there answering it,
And that number is,
it's 843-488-4237.
and if they had that listed up there, we'd have someone waiting right now to accept that call.
And the thing on any issue, not just this, but with our elected officials, they can see a poll on TV that 50% of Americans feel this way, or 35%. But when that phone's ringing in their office and they're having to hear it firsthand, so get involved. I know you're all about, activism and
That's right.
so call them. That's what they're there for.
Call them.
Call them. I know you do.
And let's go back to your question right before break, having to do with your premiums have gone up, and to explain some of the reasons why and how indeed that can be spread. One of the things that happened is that thus far it's just been physicians and hospitals in partnership with each other and other care providers. Oftentimes the insurance companies weren't in partnership, and they didn't realize that when they first decided that this is how much they would cost. They didn't understand that there would be more people coming in the door with dire illnesses.
Sure.
And so they did not spread it appropriately among all people. So a certain segment of the population took more of a hit, and some of those that were utilizing more services, because the insurance companies didn't appropriately, not willingly, not purposely, evaluate what the impact would be of insurance. So they were new at the table too, in terms of this and what it is we need to do. So for some people, that insurance premium did go up. The other piece was that the Obamacare gave certain defined benefits. And you may have been getting less than these specific 10 benefits in your insurance, and you didn't even realize it. But when Obamacare or Accountable Care said, okay, at minimum, these policies that you get must include these 10 things. Your insurance company may not have been giving it to you.
No,
you may not have been getting it privately. So now you have expanded benefits in terms of that. And unfortunately, the insurance companies are saying, well, we weren't paying for all those benefits before under your insurer. And now that we are, because the government has defined these baseline benefits, you're going to end up having to pay more. And
they opt out, which is what happened here. And so I'd had less choices.
Yes.
For what I've got, I've only got 3 companies in South Carolina that even do my plan now.
And it ought not be about repeal or replace. It ought to be about Let's fix
Let's
it.
just fix it.
Yes.
Let's fix it.
Yes, and to give an idea, people say, well, what benefits are you talking about? We're talking about emergency room benefits and how much dollars you can spend. We're talking about hospitalizations. We're talking about newborn care. We're talking about prescription drugs. So everybody in the Medicare population understands that donut hole, but the whole accountable care closed that donut hole from being 4,500. It's only about 5,000 now. So that means that the insurance company is having to bear more cost because that donut hole got smaller. So who bears the brunt of that? Are there things that really absolutely need to be fixed categorically? Categorically. But we also need to make sure that every American gets the coverage that they need for what their health conditions are. And yeah, we do have to spread it among everyone, so the healthy and unhealthy. And that was the other thing, is that under the whole accountable care organization piece, only the unhealthy signed up, more signed up than the healthy piece.
Yeah.
So you weren't able to, like insurance policies and other things, you indeed spread it among those who have accidents all the time and those who don't never have accidents.
Sure.
And that's what we need to do a better job of in the insurance thing. Now the good news is that more and more insurance companies are working with the physicians and working with the hospitals. So we have accountable care organizations now that include everybody that's sitting at the table discussing it. So we have a lot more private accountable care organizations than we ever had. We have a lot more Medicare private organizations than we ever had, that they're doing now, working in concert with each other to give the American people a better outcome in terms of their health. Because if you're healthier,
I'm a healthy.
you can go back to work.
Rock,
No,
I'm
but
blessed.
what happens when you do have an illness?
Sure.
And you do go through that and it simply strikes you down. You're like, well, I didn't think I was going to get this because I'm too young. That health care insurance is there to take care of you.
We're coming up on the end of our show.
Already?
Already, it flies by, Benny.
Well, listen, I've got to bring her back. She's available for conversation and advice. You can reach us at
4237.
488-4237.
It'd be great to have it, for a Q&A, sit down,
Hey,
your teen group, your
let's
youth
talk
group,
about it.
your meetings and everything. Good stuff.
right.
Thank you, Darralyn. Thank you for
Thank
coming
you.
by to see us.
I
Sure
appreciate
thing.
it.
Good
Take
stuff.
care.
Thank you.
Good seeing you, Benny.
Alrighty.
See, we're on different sides of a lot of things. Just fix it.
There you go.
How easy is it, man? That's why Benny and I get along. We'll see you more right after this. I talk almost as fast as Benny does when Benny's on the show. But I don't think I could ever talk as fast as our good friend Robert Raven.
Oh, yes.
He can rattle it all. 843-488-4237 is the number to find out more information and get involved in your healthcare decisions. You've got experts right here in your neighborhood. Take advantage of it. We'll see you next time on River Talk.
Thank you.
Until then, bye-bye.
All right.